Step of personal protective equipment or PPE, donning and doffing for high-risk procedure, for example AGP or treating high-risk patients. More than one donning or doffing method is acceptable depending on the supply at your facilities. Donning need to be performed before entering the surgery and doffing need to be performed prior exiting the surgery. Prepare and check the identified PPE to be put on. This is the step for donning and doffing using jumpsuit. Donning. Perform hand hygiene. Respirators are strongly recommended to be used. Put on your respirator. Extend your respirator under your chin and protect your mouth and nose. Perform the seal check. Exhale to check surface bulges and inhale to check surface collapse. Put on your jumpsuit. You may need assistance. Perform hand hygiene. Put on your inner glove. Secure your jumpsuit as shown. Put on your shoes cover. Perform hand hygiene. Put on your outer gown and tie it properly according to the design of the gown. You may also use apron as a substitute. Put on your face shield. Put on your outer glove. Pull the glove down to cover the wrist area. You are ready to enter the surgery. Doffing need to be performed in the surgery before exiting the patient room. Hand hygiene need to be done in between the step of doffing. It need to be repeated upon touching the contaminated surface. Remove your outer glove. Perform hand hygiene. Remove your outer gown or apron. Untie all ties. Roll and fold gently your outer gown. Discard into the clinical waste bin. Some gown or apron can easily be broken rather than untied. Perform hand hygiene. Remove your shield. Perform hand hygiene. Remove your jumpsuit. Unsnap or snap. Avoid touching contaminated surface. Perform hand hygiene. Gently put off your jumpsuit by roll and fold. Shoes cover might be removed together with your jumpsuit or separated depending on your supply. Upon removing the shoes cover, you have to step on the semi-clean area outside the surgery. Perform hand hygiene. Remove your respirator. Pull it away from your face. Perform hand hygiene. Remove your inner glove, following the principle clean to clean, dirty to dirty. Perform hand hygiene. You have completed your PPE doffing. These are the steps for donning and doffing using isolation gown. Donning. Perform hand hygiene. Respirators are strongly recommended to be used. Put on your respirator. Extend your respirator under your chin and protect your mouth and nose. Perform the seal check. Exhale to check surface bulges and inhale to check surface collapse. Put on your head cover. Put on your isolation gown. Ensure that all your body parts are fully covered. You may need assistance. Put on your inner glove. Secure your isolation gown as shown. Put on your shoes cover. Perform hand hygiene. Put on your outer gown and tie it properly according to the design of the gown. You may also use apron as a substitute. Put on your face shield. Put on your outer glove. Pull the glove down to cover the wrist area. You are ready to enter the surgery. Doffing needs to be performed in the surgery before exiting the patient room. Hand hygiene needs to be done in between the step of doffing. It needs to be repeated upon touching the contaminated surface. Remove your outer glove. Perform hand hygiene. Remove your outer gown or apron. Untie all ties. Some gown or apron can easily be broken rather than untied. Roll and fold gently your outer gown. Perform hand hygiene. Remove your inner gown. Untie or tie. Unsnap or snap. Some gown can be easily broken rather than untied or unsnapped. Perform hand hygiene. Remove your shield. Perform hand hygiene. Remove your head cover. Perform hand hygiene. Remove your shoes cover. Upon removing the shoes cover, you have to step on the semi-clean area outside the surgery. Perform hand hygiene. Remove your respirator. Pull it away from your feet. Perform hand hygiene. Remove your inner glove. Perform hand hygiene. You have completed your PPE doffing.